Yeah. Then you
keep this open just a little, so then when you close it, it's like, oh, privacy.
Okay.
Privacy.
Recording now.
Yeah. Whenever you're ready.
Okay. Okay, so good afternoon, Professor. This is our physical assessment checkoff. This is my patient, Sam. Sam, I just want to say my name is Matthew. I'll be your nurse today. We're going to do physical assessment checkoff. It's going to take about maybe 30, 45 minutes. Do you have to use the restroom before we start?
No, that should be good.
Okay. So I want to wash my hands thoroughly, and I'm going to provide privacy for my patient. So after I've touched this dirty curtain and I've provided privacy for my patient, I'm going to wash my hands to make sure that they're clean before I touch my patient. And so I already told the patient, asked the patient, do you have to use the restroom? Do you have any questions before we begin?
I'm all good, yeah.
Okay, no questions.
No questions, yeah.
And I also want to let you know that if I spend a good amount of time maybe listening to your heart or listening to your lung sounds, it's not because I'm concerned about anything, it's just because I want to get a thorough assessment. So please do not be alarmed, if I'm spending a good amount of time listening to your heart or your lungs. So this is my cheat sheet, by the way, Professor, my 3x5 card that I will be referring to throughout the video. So first thing, I'm just going to take a look at the patient's skin, and going to be assessing the skin color for genetic background, and everything matches. The patient doesn't appear to be diaphoresing, he's not sweating, he looks calm and comfortable and chill. So I'm also going to do a quick overview looking for like any skin lesions. Of course, I could always ask the patient, do you have any open skin lesions right now?
Nope.
No, okay.
Good, yeah.
And then so...
I just cut my thumb a little bit, but that's all.
Okay.
Healed
okay.
up. Mm-hmm.
All healed up, yeah. No complications there. And then so, of course, I'd want to do a thorough skin assessment looking at the patient's front and back side, as much skin as I can to be assessing for any lesions. And then to assess the patient's temperature, skin temperature, I'm going to use the back of my hand and then feel the patient's skin, and it feels, what's the word? Appropriate for this situation, not too cold, not too hot. And I'm also going to assess the patient's skin turgor. So I'm going to be doing this underneath the patient's clavicle. So I'm going to make sure my hands are warm before I touch the patient. And again, these hands are washed. And then, let's see, I think I'm going to go underneath your shirt, if that's okay.
You can lift it up, yeah.
Perfect. And then underneath the clavicle, I'm going to be, let's see, grab that skin, and then no tinting. The skin, the elasticity is very good. It, goes back to normal shape. So if it did tint, when I pinched that skin and it stayed up for a long time, I'd of course be worried about dehydration or some other complication. But so done with skin, I'm going to move on to the patient's head. First thing I'm going to do, I can even ask the patient, anything wrong with you? Do you have any headaches? Do you have any open wounds on your head?
No.
No, okay. And so I'm going to be assessing the patient's temporal artery. So this is the artery that's found in between the corner of the eye and the top of the ear. So I do notice the patient's wearing glasses, so...
You can take those off. Yeah.
Okay.
Yeah.
You sure?
Yeah.
Okay. So we'll put those somewhere safe for the patient while we conduct this assessment. So yeah, this temporal artery, again, corner of the eye to the top of the ear, going to be feeling for that. And there it is. Yeah, nice, strong... feel the pulsations, and they don't feel like they're abnormal pulsations, they feel appropriate. So yeah, both the patient's temporal artery. I'm also going to feel the cranium and the scalp and the patient's hair. So I'm going to get right in there and ask the patient, you feel any pain or tenderness as I do this?
Nope.
No, okay.
No pain, no tenderness.
Good. So looking for like any masses or lumps, lacerations, anything of concern. But the patient says none of this hurts. So the next thing I'm going to check is the mandibular joint. So let's see, that's going to be underneath the temporal artery, just about here. I'm going to ask the patient to open your jaw. Good, and then shut. Good, and then again, and then shut. Okay, so I'm feeling for Yeah, if I heard any clickings or if I felt anything abnormal, I would be concerned. But maybe one more time for me and then shut. Okay, yeah, feels appropriate. And then the next thing I'm going to assess is his maxillary sinus. So this is on the side of the nose, yeah. So I'm going to use my thumbs to feel just here, and then ask the patient, you feel any tenderness when I do this?
Nope.
No tenderness. Okay, when I press in, nothing hurts?
No.
Okay. So I've palpated the maxillary sinus. I'm also going to percuss. So here goes my percussion technique. So I'm going to put my finger just here and then very gently percuss. Okay, so as I percuss, I'm listening for any dullness or thuds. Dullness would be indicative of an open space behind the area I'm percussing. There's nothing back there. So clear sinuses. If I heard a thud, I'd be concerned of material back behind that sinus. So maybe a sinus blockage or whatnot, or a congested sinus. But I did assess his right maxillary sinus. I'm now going to percuss his left maxillary sinus. So I use the same finger and then, yeah, again, listening for that dullness or thudding or whatnot, but I don't hear anything of concern. So moving on, the next thing I'm going to assess is his eyes. I'm going to do a peripheral vision test. So in order to do this, may I have, let's see, Joey, can you help me find a piece of paper like this size? I'm sorry.
Yeah. Do you have it, or should I look in Sam's?
Oh, you know what I can use? I can use my credit card. So, yeah, I would make sure that these are sterile materials that I'm going to be using, but I'll give the patient this, actually, if you don't mind.
Sure.
And so we're going to use these to cover our eyes. So any eye you'd like, go ahead and cover it for me, please.
All right.
Okay. And now I'd like you to look at me, please. Yeah, good. Just like that. And I'm going to cover the same eye, and we're going to conduct this peripheral vision test. So what I want you to do is I want you to let me know when you can no longer see my finger, my wiggling finger, yeah. So both, let's see, we have our eyes covered, and we're going to start the finger in the middle, just about here. Okay, so let me know when you can no longer see this wiggling finger, okay? Go ahead, I want you to continue to look into my eye.
Okay.
Just use your peripheral vision, yeah. Okay, so here we go. Let me know when no longer can. Can't, okay. And then let me know when you can. Can, okay. And let me know when you cannot.
Cannot.
Okay, and again when you can. Can, okay. And now we're going to try the other side as well. Yeah, so we're going to switch eyes. Good. Okay, and then you're going to continue to look into my eye, and again let me know when you can no longer see this finger. Cannot. Okay, and then let me know when you can. You can. Okay, and again cannot. Okay, and again when you can. Okay. So, with my assessment, I believe the patient's peripheral vision is A-OK. So we're going to move on to the corneal light reflex. So this is going to be used with my pen lights, and basically I'm going to shine the light into the patient's eye to make sure that the reflected light that I see out of his cornea is at the same location on both eyes, yeah? So if one was way out of whack, I would be concerned. But let's take a look. So, Sam, I'd like you to look maybe back behind me at this curtain here, and then just keep your eyes focused on that, and I'm going to bring this pin light into your eyes to check the light reflex. So go ahead and look back here at this.
Okay.
So, and if you can, you kind of adjust your body a little bit and look like over my...
Sure.
Yeah, okay. Good, good, good. That's the one. And then keep your eyes focused back there. Okay, and I'm going to bring this light in. So is this thing working? Okay. Okay. Try this side. Okay, good, good, good. And then yeah, so the light reflects off the same location in both his right and left cornea, so that's a good sign. If I was getting a reflex, weird angles on different eyes, I would be concerned. But okay, let's see. Next we're going to do the 6 gazes, yeah? So I'd like you to take a look at my nose, please. Focus on my nose. And when I tell you to, I want you to adjust your focus to the silver tip of my pen. So first my nose, okay, and then go ahead and take a look at the pen. Okay, and go ahead and track this pen with your eyes. So 1, 2, 3, good, and then keep watching. Okay, and then keep watching. One more. Good, and then back to my nose. Good, okay. So just making sure that the patient's eyes are tracking simultaneously, using both eyes to track, and they did. So next I'm going to check to make sure that the pupils are equal, round, reactive to light, and accommodating. So what I'm going to do is, again, I'm going to have you look at my nose. Okay, and I'm going to shine this pin light into your eye. Okay, and then that eye constricts, and at the same time that his left eye constricts, when I shine the light into his left eye, the right eye also constricts, which is a good sign, yeah? Even though I'm not shining the light into his right eye, it still simultaneously constricts. So I'm going to check his right eye now to make sure that when I shine the light in his right eye, his left eye also constricts. So one more time at my nose, please. Good, good. So again, they constricted at the same time. So his pupils are equal in size. Let's see, I'm going to take a look, and they are round, and they do react to light simultaneously. And as far as accommodation goes, that's going to be another test. So Sam, I'd like you to take a look at the silver tip at the end of my pen light, and I'm going to bring this silver tip closer to your nose, and I want you to track that silver tip with your eyes, okay?
All right.
So here we go, silver tip, and keep watching, okay, good, 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 okay. Okay, yeah, so not only did his eyes, were they accommodating simultaneously at the same time, but also when the eyes do accommodate on that focal point, they constrict, which is common as far as my readings go. So, okay. And then lastly, or almost lastly, where I'm going to take a look at the patient's conjunctiva to make sure they're pink and moist and no inflammation or anything of concern. So I can ask the patient, you know, well, if the patient didn't have clean hands, perhaps I would do this with my clean hands. But I want the patient to basically pull down his eyelids. So if you can do this for me, I'd make sure that the patient, maybe, you know, alcohol or whatnot. But yeah, I'm just going to take a look. So he's using clean hands to, yeah, okay, so I can see his conjunctiva. Again, I don't see any debris in there or inflammation, all power, yeah. And then they're pink and moist. But yeah, looking for debris or inflammation, pink eye, red eye, whatever. But yeah, nothing of concern there. And then fundoscope. Okay, so this is something, let's see, I read about. So I'm going to pretend this is my fundoscope. And I'm going to put this really close to my eye. And I am going to bring this into the patient's eye on the same side. And I'm going to get closer and closer to his eye with my fundoscope. And that fundoscope's going to have a bright light on it. I'm going to be shining that bright light into his eye. And so this is how the test looks. Again, the fundoscope close to my eye, and I'm going to have the patient look into that bright light in the fundoscope. And we're going to get nice and close there. And then, yeah. So what I'm looking for is, I'm looking for any black areas that light is shining. When I shine that light into the patient's eyes, any black areas would be like indicative of cataracts. And so that would be something of concern. So I would do the fundoscope test on both eyes to check for cataracts. Of course, be a little bit more alarmed if this patient was older. Okay, moving on to the ears. First thing I'm going to do is I'm going to take a general look at the patient's ears. You know, let's see, can you pull your hair back for me?
Oh, sure, yeah.
Perfect. Okay, thank you. So looking for, any redness or draining in either of the ears. Okay. And then, so yeah, just from like an external view, they look okay. I'm going to use my otoscope also to shine light into the patient's ear. And then, so for an adult patient, I'm going to pull the patient's pinna up and back in order to access that ear canal, and I'm going to use my otoscope and get it get it into that ear canal, and then shine a light onto his tympanic membrane. And so when I pull the pinna up and back and shine that light into his tympanic membrane, I'm going to be looking for a pearly gray tympanic membrane that's pulled in the center. As I'm assessing his right ear, the light should reflect at 5 o'clock. So let me think, patient's right ear, that light should reflect at 5 o'clock on his tympanic membrane that's pearly gray and pulled in the center. In his left ear, it should be at 7 o'clock. So that test is going to look a little something like this. Let's see. So patient's left ear should be 7 o'clock, pinna up and back, and then let's see, that otoscope into the ear canal, tympanic membrane, 7 o'clock. Okay, and then also assessing for any drainage there, earwax buildup. Cerumen, I think is the, is normal. Yeah, of course, looking for excessive, but a little bit there is A-okay. So again, with the right ear now, let's see, pinna up and back, and otoscope in, tympanic membrane. And then let's see, so right ear is 5 o'clock. So pearly gray.
I like feel it in there.
Yeah.
Oh yeah.
Okay, so that basically, and then of course I could ask the patient, you have any hearing problems, anything I should be concerned about with any of these, anything?
No hearing problem.
Okay. No problems with your eyes. I know you're wearing glasses, so that could of course be a further assessment as far as you were having difficulties with the prescription that you've been given. But
Oh,
good.
The glasses, yeah.
Okay, so just for time's sake, moving on to the nose, we will check patency. So again, with the patient's clean hands, I would ask the patient to cover one of his nostrils, and then I'd like to hear the patient breathe out of the other nostril. So if you can go ahead and demonstrate that for me, Sam. Anyone you'd like. Okay, and then of course asking the patient, do you feel any difficulties when you do that?
No.
Okay.
Yeah. I think the left was a little bit easier to breathe through than the right.
Okay. Left was easier than the right, and yeah. Okay. So of course this is an opportunity for further assessment. I could ask the patient, has it always been like that? Are you, experiencing acute?
No, there hasn't been any difficulties or anything. But I'm not sure if it's always been like that.
Okay.
I'll keep that in mind now.
Okay. And anything to report as far as, have you been having a flu or cold lately?
No.
Okay. And so, of course, when there's anything abnormal, even slightly, I could go on for a good amount of time as far as further assessment goes, asking the patient about drainage. Any drainage lately?
No.
Okay.
I'm good. Yeah.
Okay. And then, so that's assess the patient's patency. Moving on to, I'm going to use my otoscope again. So, of course, making sure that it's not the same instrument that I've inserted into the patient's ears. This will be a clean instrument that will go into the patient's nose to assess his mucosa, septum, turbinates. So I would have the patient lean his head back a little bit and then stick this otoscope into his ear. And you know what? I can shine this light in and take a good look actually. And then taking a look at his mucosa, making sure that it's pink and not inflamed and red, which may be indicative of, maybe the patient's been blowing his nose a lot, or he has had the flu or cold or drainage going in or whatever. But this patient's nose mucosa looks pink and normal. Turbinates are going to warm and filter and humidify the air, so I can take a look at those and see if those are inflamed. I was also reading in the book about a deviated septum. Once looking into the patient's nose with an otoscope may look like a shelf, is what the book said. So, yeah, I can take another quick look and see if the patient's, let's see, yeah, septum was sticking out like a shelf. That may be indicative of a deviated septum. But okay, moving on to the patient's mouth. Again, I'd have the patient use his clean hands to perhaps retract his lips so I could take a look at his gum. So if you wouldn't mind, maybe, you know, pulling up your lip a little bit, or maybe, yeah. So just taking a look at the patient's gums to see, okay, and then how about the bottom? Okay, so looking for any black areas or areas of infection. Okay, I'll pop. And then can you smile for me? Good. And then go ahead and open your mouth for me, please. Okay, and then I'm going to take a look. Okay, so looking at his hard palate. And let's see, this is called the, go ahead and relax for me. So, yeah, I've checked the patient's teeth and his bite, gums. I looked at his gums for swelling. I'm going to take a look at his tonsils, which will be on both sides looking down the patient's throat. The uvula would hang in the middle, but the tonsils will be on each side. So I'll have the patient, you know, you can go ahead and open your mouth and say ah for me. I'm going to try to take a look back there. Good, okay, I'll pow. So yeah, you know, looking for inflamed tonsils, tonsillitis, whatnot, making sure the uvula is not red. And I have been assessing the tongue. I'm going to take a look underneath the tongue and look at the frenulum. So if you can stick, you know, show me the back side, the bottom of your tongue. Good, okay. Good, okay. So making sure that the frenulum is intact and not torn. And then I took a look at his palate. So I think that pretty much sums up the patient's mouth. Of course, asking questions, any complications with your mouth, any pain in there, anything you'd like me to know about?
No, it's all good. Yeah.
Okay. Moving on to the neck. Let's see. For this one, I'm going to come behind. Okay, and then I'll take a look from the front, looking for symmetry of the patient's neck. And I'm going to take a look behind. I think you can actually stay here because I want the instructor to see as I assess for. Yeah. Okay. And then so, let's see. Taking a look at the patient's neck posteriorly, maybe looking for. Again, symmetry and lumps. I'm going to feel patient's neck for any lumps, looking for any pulsations. And then, let's see, the book talked about neck veins being not normally palpable in the human adult. So, yeah, feeling for the neck veins, palpating for the neck veins, but then, yeah, not feeling them. I do feel his carotid artery, so I'm palpating one hand at a time his carotid artery, and I feel it nice and strong there. And I'm going to also, let's see, I felt it on the left side, and now there it is, okay. And then so I felt it on both sides, and I'm also going to auscultate for the patient's I'm going to auscultate the patient's carotid artery, so I think I can even take this down. Maybe not. Okay, that's okay. So yeah, let's see, I'm going to auscultate the patient. Oh, sorry.
Oh, no worries.
So making sure that my stethoscope is clean before I place this stethoscope on this patient. Let's see. So I would hear a bruit, or I'd feel a thrill as I'm assessing this patient's carotid artery. Moving on to lymph nodes. Actually, I'm going to do No, it can. Okay, moving on to lymph nodes, I'm going to come back in front of the patient, actually. Just because it's a little hard to assess. Actually, can I make you, let's see, maybe sit here, please. Okay. Check. Yes, please. So, of course, okay. And now we'll go on to, feeling the patient's lymph nodes. So again, I'm going to have that patient, okay. So let me think back. Yeah. Let me know if you feel any pain or tenderness as I palpate these lymph nodes. Yeah, let me think. So yeah. Lymph nodes, dang, not coming to me. 12 of them, if I remember correct. Do they start up here? Let me think. Did I draw a diagram? I didn't, but yeah, I remember, let's see, submental, submandibular, and then they run down the neck. But yeah, I'm just going to do my best, and then let me know if you feel. Here we go. I know that there's lymph nodes located here. And then, so yeah, any pain or tenderness as I. Oh, okay. And then let's see, submental would be here. And then is that right? Submental and submandibular. But then, yeah, and then they run this way too. So no pain or tenderness as I. Okay, feel his lymph nodes, and then I'm going to check the patient's range of motion with his neck. So if you can look to the left and look to the right. Good, and then straight. Okay, and then back. And chin to your chest. Okay, and then straight. Good. Any pain when you do that?
No.
Okay. So I'm also going to assess the patient's cranial nerve number 11. So I'd like the patient to shrug his shoulders. Okay, and down. And I'm actually going to put some pressure, and then one more time. Okay, and down. Any pain when you do that?
No.
Okay. And then I'm actually going to put a little bit of pressure onto your. So I want you to, I'm going to put a little bit of force on there, and then I want you to fight that force and turn your head when I ask you to. So this is also checking for cranial nerve number 11. So go ahead and turn your head to the right. Good. Okay, and then straight, and then to the left. Good. Okay. And then, so yeah, just making sure that the patient's cranial nerve number 11 is strong, and he's able to, turn his head even though I'm applying force there. So lastly, with the neck, I'm going to palpate the patient's thyroid. So, okay. Let's see, cricoid membrane. Below that, I'm going to assess for the patient's thyroid. So again, in the book, the adult human's thyroid is usually not palpable. An enlarged thyroid would be, also feeling for like a goiter or whatnot. But in a normal, healthy human adult, the human thyroid is not palpable. But I'm going to take a look. Let's see. Okay, I don't feel any inflamed material in that area, so I'm not worried about an inflamed thyroid. Okay. Moving on to his chest, I'm going to move posteriorly again. I'm going to take a look at the patient's the general shape of his thorax. Let me think. Can I have you? Yeah, this is a good idea. Stand up for me, please.
All right.
And then I'm actually going to move this chair in front of you. And then can you straddle that chair, please?
Oh, yeah.
Perfect. So, and then also, can you take your shirt up so I can take a look at your thorax? Okay. So yeah, again, the patient is in a private area here as I'm taking a look at his, let's see, the shape of his thorax, making sure that the patient. Okay. Yeah, good idea, because this will help with all of the other assessments we're about to do. So yeah, taking a look at the patient's thorax, the shape of the thorax, making sure that the patient has a straight spine and his thorax is symmetric and elliptical, and he has downward sloping ribs of appropriate color. And then downward sloping ribs I do see. And then let's see, next we will do the T9, T10 pinch to assess for symmetry. So let's see, patient T9, T10, I'm going to put my warm hands on the patient, and then at T9, thoracic 10 vertebrae, I'm going to pinch. up. And I want the patient to take a deep breath in. Now. Good. Again. Good. Okay, and then so just seeing as the patient does those breaths, if my thumbs move symmetrically, and they do. So the next test I'm going to do, test for vocal fremitus. So I'm going to use the palm of my hand against the various locations on the patient's back, and I'm going to have the patient, I want you to say 99 when I ask you to.
Okay.
So go ahead.
99.
Again.
99.
Okay, again.
99.
Uh-huh.
99.
Okay.
99.
Uh-huh.
99.
Okay.
99.
Good.
99.
Good. Okay, so feeling for vibrations. Yeah. As far as I know, let me think. Yeah, I would be concerned if the vibrations were, at an increased, if I felt increased vibrations. I do feel vibrations, but they're nothing to be concerned of with my student experience. So I'm gonna roll with that. Okay. Going to do percussion now. And so again, my percussion technique, using my middle finger, and then percussing different areas, and kind of using my right hand. It's all on the wrist right here, so I'm going to percuss different areas of the patient's backside. Okay, so yeah, 1, 2, 3, and then we'll go here. And then so doing equal sides on each side, equal locations on each side. Again, assessing, percussing for like those dull, hyper-resonant areas, dull areas being no material back there, hyper-resonance maybe being something back there. But okay, I'm going to also auscultate for breath sounds in those same locations that I percussed. So, okay. So I want you to just go ahead and breathe normally for me, just in and out, okay?
Okay.
So clean stethoscope, warm stethoscope onto the patient's backside. And so go ahead and just breathe for me. Okay, so I've done breath sounds, listening for any wheezes or crackles, fine crackles, coarse crackles, anything of the sort. So I'm also going to have the patient, I'm going to do those breath sounds again, same locations, and this is a whispered pectoral liquid or something of the sort. So I'm going to auscultate in the same locations, and I'm going to have the patient whisper 99, and normally I should not be able to hear the patient whispered at 99, but if there was maybe some congestion in the patient's lungs, that whispered word may vibrate, and I would be able to hear if there was some sort of complication. But go ahead and whisper 99 for me. Okay, and again. Okay, and again. And again. Okay, and again. Okay, and again. Yeah, super interesting, because I saw a video that was saying it's normal to hear the 99 up here, which I did, and then not hear down here, which I did not. So, okay, that takes care of that. I would like the patient to turn around on that chair for me, please. That's your front side. Okay, so taking a look at the patient's chest, looking for any pulsations. Let's see, abnormal pulsations as the patient's breathing, and looking at his skin. Again, because I haven't assessed this skin yet, but yeah, no lacerations or, let's see, as the patient breathes, I just want to make sure that the chest is expanding symmetrically. Yeah, looking for flail chest or any complications. I'm going to palpate the patient's rib cage. Yeah. My clean, warm hands on the patient's rib cage as you put. Continue to breathe for me at a even pace, just whatever is comfortable for you. And then, so yeah, just seeing like if maybe one side rises and the other doesn't. So okay, I'm also going to do breath sounds. Okay, so just go ahead and breathe normally for me. I don't want you to hold your breath. I don't want you to pass out. Just go ahead and breathe. So a clean stethoscope on the patient. Okay, so again, listening for those atelectic lung sounds, I believe is the word, adventitious, breath sounds, yeah, crackles, wheezes, stridor, anything of the sort. I did also read about in the book how, an individual with hair on their chest, the hair against the stethoscope may give, an interesting, you may hear an interesting sound, an abnormal sound, but just something to note. So I'm going to have the patient lay down.
You have hair on there.
Okay, so just finishing up, really, I think the last thing we're going to do is the heart. So if you could lay down for me, please.
Okay.
To palpate the patient's apex pulse, apical pulse, point of maximal impulse, all known, all terms for the same location. So this location is found on the precordium, farthest lateral and farthest inferiorly on the sternum, from the sternum. And then so I'm going to palpate for the PMI, point of maximal impulse. So just about here. Yeah, and I can feel the patient's heartbeat just there. So not only am I going to palpate this area, but I'm also going to auscultate this area. Okay, and I'm also going to use my mnemonic Midterm to listen to the different heart valves and herbs point on the patient's chest. So yeah, the the atrial valve is going to be heard in the second intercostal space, right sternal border. So I can go ahead and let's see, clavicle 1. So second intercostal space, right sternal border, listening for the atrial valve. Okay, and then pulmonic valve will be second intercostal space, left sternal border, so just moving right across. Left sternal border, pulmonic valve. Herbs point will be one intercostal space down, so third intercostal space, left sternal border. Tricuspid will be fifth intercostal space. I'm at the third, so fifth intercostal space, left sternal border, and then let's see, the mitral valve, fifth intercostal space, mid-clavicular line. So I'm going to stay in this intercostal space and just move it across to the mid-clavicular line, and then listening for the heart sounds with both my bell and diaphragm at these various locations. So, just for time's sake, and that was quick, but I think of course, if I had more time, I would listen all of these areas longer, listening for any heart murmurs, S3, S4, gallops, anything out of abnormal. Yeah, I should be listening for an S1, no Tennessees, no Kentuckys, etc., etc. Lastly, I'm going to compare the patient's apical pulse to his carotid pulse. So back to his apical pulse. And let's see, so that was just here. And then, yeah, I can hear nice, strong heartbeat. So I'm going to compare this apical pulse to the patient's carotid pulse. And they match up evenly. And then so the last thing I'm going to do is I'm going to have the patient turn to his left side. And I'm going to use the bell of my stethoscope to listen to his apex again. So this may be something, I'm sorry, do you mind if, just want her to see, yeah. So listening to the apex, PMI, apical pulse, all known as the same thing, bell of my stethoscope, patient on his left side. Okay. And then, yeah, I'll finish, Sam. You can go ahead and stand up and put your shirt back on and get comfortable. Let me know if you have any questions. Gonna wash my hands. All that good stuff that a physical assessment contains. But yeah, I think that's it.
All right.
Cool. Geez, see, lengthy, huh?